Okay, so today's topic is anatomy of the male reproductive system. So in this lecture, we will discuss about the different components of the male reproductive system. Then we'll describe the primary and secondary sex organs in case of male. Then we'll talk about the male external genital organs. Okay, so these are the objectives for this lecture. So coming to the components of the male reproductive system, all the components, how they are classified. So they are classified into primary and secondary organs. The primary organ in case of male will be the testis. Singular is testis, IS, and in case of more than one, both the testes together they are called as ES. Pronunciation is same, but only difference in the spelling. So testis is the primary sex organ where these sperms are actually produced. So that will become the primary sex organ. Then the tract which will carry these sperms will be called as the reproductive tract. It consists of the epidermis. Here is the testis, as you can see, there is a cut section of the same. Now coming to the reproductive tract, epidermis. This is epidermis. Here is the cut section of the epidermis. Then we have the vas deferens. This is called as the long tube, muscular tube. This is called as vas deferens, or it is also called as the ductus deferens. Okay, so here it is the same cut section. Then the vas deferens will pass through actually with many structures together. That is called as the spermatic cord. If you see here, so here is the testis. Within the here is the epidermis. Then the vas deferens is here, long muscular tube. Along with that, the other structures together, packed together in a long tube-like structure, that will be called as the spermatic cord. This is the spermatic cord here. So spermatic cord contains the vas deferens. Okay, so this is the reproductive tract. Then coming to the accessory sex organ or the secondary sex organs, those are the seminiferous tubules, the seminal vesicles. Sorry, the seminal vesicles here. So here you can see a seminiferous tubules will be within the testis. So it is part of the primary sex organ. Sorry. So the accessory organs will be the seminal vesicles. These are the seminal vesicles. Here, this is the cut section of the same. Then the prostate. Here, this is the prostate. Then the bulbourethral glands. These are the small glands here near the apex of the prostate, that is called as the bulbourethral gland. They are also called as the corpus gland. Okay, these are the accessory or secondary sex organs in case of male. Then coming to the external genitalia, which consists of the penis as well as the scrotum. Uh, Coming to the scrotum, so this is the bag, muscular bag. It is a cutaneous pouch of loose skin and superficial fascia. So it is a cutaneous bag, and it is loose skin around it. It is cutaneous pouch of loose skin and superficial fascia. Superficial fascia will be there. Within that, there is also a muscular layer. It is divided on its surface into two lateral portions by a ridge or raphe. In the center, this bag is divided into two parts, right and left, by a median raphe or ridge. This ridge will divide into two small pockets, which will contain the testes. The left scrotum is slightly lower than the right. Okay, if you see here, this is the right and this is the left. The left scrotum is slightly lower compared to the right. Okay, and corresponds with the greater length of the left spermatic cord. So the left spermatic cord, because this testis is lower, so it should be longer. So the left spermatic cord, this is spermatic cord, is longer compared to the right one. Okay. The dartos muscle lie within the superficial fascia. As I said, this is a cutomuscular bag. So within the superficial fascia, there is a muscle layer. It has a special muscle called as, it has a specific name called as the dartos muscle. So the dartos muscle is within the wall of this bag. Outside will be the skin, and inside will be the superficial fascia containing this dartos muscle. If you can see here, this is the muscle which is called as the dartos muscle within the superficial fascia. The dartos muscle lie within the superficial fascia and replaces the scarpa fascia of the anti-abdominal wall. In the anti-abdominal wall, there is a fascia, special fascia called as the scarpa fascia. So that is replaced when it comes into the scrotum. So even though this is an extension from the abdomen, so the scarpa fascia of the abdomen is replaced by this special muscle here that is called as the dartos muscle. This is the subcutaneous muscle, dartos muscle. Okay. It has thin skin with sparse hair and sebaceous gland. The skin here it will be loose and it has sparse hair, few hairs, as well as the sebaceous gland within this skin, which is covering the scrotum. So, what is the function of this scrotum? Why there is a scrotum? Okay, so this is the main function is to house the testis. So it will as a house it will protect the testis. It will house, it will keep the testis as well as it protects the testis. And the second and very important function is it regulates the testicular temperature. As you know, the testis needs a temperature lower than the body temperature. So if it is in the within the body, then the testis cannot produce this sperm. So it needs 4 to 5 degree lower temperature. For that reason, the scrotum is outside the body and it hangs the scrotum outside the body so that it can lower the temperature of the testis. So that's why the regulation of the testicular temperature is very important, which is done by this scrotum. Okay, now coming to the primary, the main organ, that is the testis. So here you can see this is the testis here, and this is the scrotum. Okay, the testes are paired, almond-shaped gonads that are suspended in the scrotum by the spermatic cord. As you know, these are the almond shape, means oval shape, paired because they are right and left both the sides, so they are in pair and suspended from above by this spermatic cord. This is the spermatic. As you can see here now, you can see all the layers of the spermatic cord as well as structures within the spermatic cord. Okay, so it is not only the vas difference, but other structures are there. They like the testicular artery, pampaniform plexus, everything, cutaneous fat, nerves, lymphatics, everything. Okay. So the volume of this testis is almost 20 to 25 ml because the sperms are produced in a fluid medium. So it is measured in volumes, and this is 20 to 25 ml. And the length, if you want to physically measure the length, it is almost 4 to 5 centimeters in length. And the weight is very less, it is 10 to 15 grams in weight. Coming to the functions, as you know, the main primary or function of this testis is the spermatogenesis. Spermatogenesis means production of the sperm. So this is the main site for the spermatogenesis. Then also apart from the spermatogenesis, it also has a very important function that it is the production of the hormone, the main hormone, the male hormone called as the androgen or the testosterone, the male hormone which gives the physical shape to the human, the male structure as well as development of hair, male hairs, beard, mustache, everything. So this hormone, the testosterone, is also produced within the testis. So it does two important functions. One is the spermatogenesis as well as the production of the male hormone. Now coming to the protection of the testis. The testis is protected by three coverings. So three important coverings are there. One is called as the outermost uh, covering called as the tunica uh, vaginalis. Tunica means covering, vaginalis is the outer covering. Okay. So tunica vaginalis is a peritoneal covering, so it is serous in nature, formed of the parietal and visceral layer. If you see here, so this is the tunica vaginalis. It has two layers. Okay, so it is a cavity, and and it is has two layers. One is the parietal layer, which will be outside, and the visceral layer inside. If you see here, tunica visceral layer of the tunica vaginalis, and this is the parietal layer of the tunica vaginalis. So white colored structure, this is the parietal layer, and the red colored structure inside, that is the visceral layer. In between there is a space filled with serous fluid. That's why it is called as serous covering. It surrounds not only the testis but also epidermis. If you see here, it is not only covering the testis but also part of the epidermis. So it is covering testis as well as the epidermis. It allows free movement of testis within the scrotum. As you can see here, because it is now hanging within a fluid cavity, so the testis can move and twist and turn. So it gives free movement to the testis within the scrotum. Now coming to the next layer, that is called as the tunica albuginea. Albuginea means whitish, so it is a whitish fibrous tissue. So if you see here, this covering deep to the tunica, the visceral layer of the tunica vaginalis, you can see the next layer, that is the tunica albuginea. This is the tunica albuginea. Okay, whitish fibrous capsule. Then inside there is one more covering called as the tunica vasculosa. Vasculosa means vessels. Okay, so it is vascular layer of the testis consisting of the plexus of blood vessels held together by delicate areolar tissue. It clothes the inner surface of the tunica albuginea and the different septa in the interior of the gland. If you see here, this is the tunica albuginea. It will give septa inside, which will divide the whole of the testis into lobes and lobules. So from inside this tunica albuginea, there is an inner layer, thin layer of vascular layer, that is called as the tunica vasculosa. So the tunica vasculosa will line the inner part of the tunica albuginea. So this is a vascular layer. Okay, so there are three layers: tunica vaginalis outside, then we have the tunica albuginea, and the innermost, the tunica vasculosa. The internal structure of the testis. Now coming to the internal structure, will study what can be seen with the naked eyes. The microscopic structure you will study in the histology. Here we'll confine to that part which can be seen even with a hand lens. Okay, with the naked eyes and with the hand lens, if you take a section. So this is the section taken in the testis and the epidermis. These are the structures you can see. The fibrous septa extend from the capsule, dividing the testis into 200 to 300 lobes. As I said, the tunica albuginea, which is the whitish layer, gives septa inside. So septum. So this will divide the whole of the testis into 200 to 300 lobules. Between the two septa, this is called as one lobule. Between the two septa, there is one lobule. Here is the second lobule, third lobule, like this. Okay. So there will be 200 to 300 lobules, an average of 250, and each lobule contains almost 1 to 3 seminiferous tubules. So if you take an average of 2, almost 500 seminiferous tubules will be there in 250 lobules. Okay, so each lobule will contain, if you take the average of 1 to 3, it will be 2. So if you imagine that there are 2 in each lobule, there are 250 lobules, so there should be 500 seminiferous tubules at least. Okay, the seminiferous tubules, each is almost 60 centimeters coiled long tube. It is a very long tube of almost 60 centimeters, but it is confined uh, into a very small area within the lobule. So it is a 60 centimeter long coiled tube. Okay. There, these seminiferous tubules are the most primary sites for the spermatogenesis. The production of the sperms will be taking place within these seminiferous tubules. In the histology, again, you will study the section of the seminiferous tubules into smaller sections, rounded, and then you can see the different stages of the spermatogenesis, the sperms formation. Okay, so this is what you can see with the naked eyes, with the hand lens. They are site of spermatogenesis. These are this seminiferous tubules. They form the bulk of the testicular tissue. So the whole of the testis will be filled with this seminiferous tubule. They form the bulk. In between the seminiferous tubule lie the interstitial cells of bleeding, which secrete the testosterone. So in between these seminiferous tubules, there will be small cells which are called as the interstitial cells. They are also called as interstitial cells of Leydig, which will secrete the testosterone, the male hormone testosterone. Now coming to the retay testis, the sperms travel through the testes from the tubules through a network of ducts called as the retay testis to the epidermis. You see here, all the seminiferous tubules will join at this junction where they connect with each other and form a network. This is called as the retay testis before opening into the epidermis. So there will be formation of a network of seminiferous tubules. This is called as the retay testis before opening into the epidermis. Now coming to the blood supply of the testis, it is supplied by the testicular artery. If you see here, this is a testicular artery on either side, which is a branch from the abdominal aorta. So testis will be supplied by the testicular artery from the abdominal aorta. Okay, starting with a very high position because initially it is steady development. The testis will be here in the initial stage of development. Later they descend, that is called as the descent of the testis. Okay, so they will be here, so that's why they carry the blood supply from they have where they have origin. So this is by the testicular artery. Okay, it arises from the abdominal aorta at the level of L3, very high, where L3 at the level of L3, just below the renal arteries. Okay. Coming to the venous drainage has a slightly peculiar nature. They form a plexus of veins around the testis and within the spermatic cord. If you see here, there is a plexus. This is called as the pampaniform plexus, venous plexus or of pampaniform. Okay, if you see here, pampaniform plexus. So pampaniform plexus are around the testis as well as the spermatic cord, which will help in the regulation of the temperature of the testis. About dozen of veins which form a network within the spermatic cord, as you can see here, they form a network. They become larger as they approach the inguinal canal to form the testicular vein. Further, as they go into the inguinal canal, then they form the vein called as the testicular vein, which will drain actually the testis. The right vein drains into the inferior vena cava. There is a slight difference on the right and left side. If you see on the right side, it drains into the inferior vena cava, but on the left side, it drains not into the inferior vena cava, but into the left renal vein at right angles, and from there into the inferior vena cava. So the left vein drains into the left renal vein and from there into the inferior cava. This is very important clinically because it is draining, going against gravity and draining at 90 degree. This can have reverse flow, backflow of venous or stagnation of the venous blood, and it leads to varicosity of this vein called as the varicose, which is very common on the left side compared to the right side. This is because the right vein drains at an acute angle, but this drains at right angles against gravity. Okay, so that's why backflow is more common on the left side. So here they have shown this is the varicose C. So right side it can be drained, but on the left side because of the backflow, as you can see here, so it can lead to varicosity of this. This is called as varicose C, clinically important. Coming to the lymphatic drainage will be by the testicular lymphatics, which end in the lumbar or the para-aortic group of lymph nodes. Here there will be group of lymph nodes which we call as the para-aortic beside the aorta. Coming to the scrotum, penis, and prepuce, they will terminate in the superficial. Even though the testis drains deep inside, but the scrotum, penis, and the prepuce skin will drain into the superficial inguinal group of lymph nodes. So there is difference in the lymphatic drainage for the testis and the scrotum and penis. Now coming to the one important muscle called as cremastic muscle. Cremastic muscle. Okay, the cremastic muscle is a thin layer of skeletal muscle found in the inguinal canal and the scrotum between the external and internal layer of the spermatic fascia surrounding the testis and the spermatic cord. Around the spermatic cord, if you see here, there is a spermatic cord. Around that, there is a muscle called as the cremastic muscle, as well as the cremastic fascia. This cremastic muscle, which is covering the spermatic cord, is very important. Why? I will talk about that later. Okay. Coming to the blood supply, it is by the cremastic artery, which is a branch of the inferior epigastric artery. Nerve supply is by the cremastic muscle, is innervated from the genital branch of genitourinary nerve. This is very important. Just remember because later clinically it is important. genital branch of the genitofemoral nerve, which is nervating this muscle. Okay. Now, what happens? There is a reflex called as the cremastic reflex. Cremastic reflex. Okay. So this is elicited by a technique called as here the examiner strokes or pinches the skin in the upper medial thigh. It causes the cremastic muscle to contract. So if you stimulate the skin on the medial surface of the thigh, that will lead to cremastic reflex, because the same nerve, which is, that is the genital branch of genitofemoral nerve, which is supplying this muscle, also supplies the medial side of the thigh. So when you stroke that muscle, this skin, so this cremastic muscle will contract and it will pull the testis upwards. This is called as the cremastic reflex. So this can be elicited by the this technique where you stroke the medial side of the thigh. And you should know why it happens, because of the same nerve, genital branch of genitofemoral nerve, supplying both the cremastic muscle as the medial side of the thigh. Observation: rise of testis on the same side. As I said, the testis will be pulled up when there is cremastic reflex. What does the absence indicate? So, the absence, no testicle rise. This can be suggestive of the testicular torsion. Okay, it can suggest that there is testicular torsion. Okay. Now coming to the next structure, that is the epidermis. So here you can see here, this is the tunica vaginalis. Okay, then here this is the tunica albuginea and tunica vasculosa on the side. So tunica albuginea, if you can see here, is the septas, and which we are dividing the whole testis into lobules. Within the lobules, you can see the similar tubules which join here to form a network called a rete testis. Now they all drain into the epidermis through efferent duct tubes. Okay, and it will drain into a single coiled tube called as the epidermis. Initially, it will be multiple tubules, efferent duct tubes, which all join together to form a single duct called as the duct of the epidermis. It is a single coiled tube, almost 6 centimeters, 6 meters long. Sorry, it is 6 meters long, very long tube. But again, it is coiled into a very small area. Okay, site located on the superior and posterior margin of the testis. So testis is here on the superior as well as the posterior margin of the testis is this location of this epidermis. Parts, it is divided into three parts: the head, body, and the tail. So this coil tube is in a very small area and it divided into the head part, the body, and the tail. This is called as the caput epidermis. This is called as the corpus epidermis. Corpus means body, caput means head, and this is the tail, that is called as the chorda epidermis. Chorda means tail. Okay, so these are the other terms which are used here. Okay. The tail is continuous with the vas difference. If you see, this tail is continuous with a long duct. This is called as the ductus difference, or also called as the vas difference. So it continues as the vas difference. Functions of the epidermis. What are the functions of the epidermis? Why there is epidermis? One is it secretes and absorbs the nourishing fluid. So it will secrete the nourishing fluid which is necessary for the survival of the testis, the sperm, sorry. So which are responsible for the viability as well as the nourishing of the sperms. So that is secreted by this epidermis. Also absorbs the excessive fluid which is produced here. Then it also recycles the damaged spermatozoa. Any damaged spermatozoa or the unfit spermatozoa are all recycled or phagocyted here, okay, or removed here. Then it also stores the spermatozoa up to 2 weeks. Why it keeps the sperms here for 2 weeks? To allow for physiological maturation of the sperms. The sperms which are produced in the testes are not mature enough. Okay, so they are matured in the epidermis by the storage here for 2 weeks, as well as providing nourishment by the same epidermis, so that the sperms become actually the mature and motile. Then coming to the next structure, that is the from the epidermis we have long tube. This is called as the vas deferens. Vas deferens. It is a muscular tube almost 45 centimeters long, carries sperms from the epidermis to the pelvic cavity. If you see here, now the sperms are carried from the scrotum back into the pelvic cavity, back into the pelvic cavity. Okay, passes through the inguinal canal as one of the content of the spermatic cord, as you saw. The vas deferens is not alone, but it has along with that many structures which together form the spermatic cord. Passes through the inguinal canal. It crosses the lower end of the ureter. If you see here, it crosses, this is the ureter draining into the bladder. So just beside that, on the medial side, you can see the vas deferens. So if you want to trace the vas deferens, this is much more clear area where just beside the ureter you can trace this vas deferens. Its terminal part is dilated to form the ampulla of the vas deferens. If you see here, as it comes down, it is dilated to form the ampulla of the vas. Ampulla of vas. It joins the duct of the seminal vesicle. If you see here, this is beside that is the seminal vesicle to form the ejaculatory duct. So this the duct of the vas deferens joins with the duct of the seminal vesicle to form the ejaculatory duct. Now this is the ejaculatory duct. So the two ducts join together to form a single duct. This is called as the ejaculatory duct, which opens into the prostatic urethra. It passes through the prostate and then opens into the prostatic urethra. This is the urethra. We have studied the three parts of the urethra: prostatic urethra, membranous, as well as the penile urethra. So you have studied the three parts. Now, if you can see here, this ejaculatory duct is opening into the prostatic urethra. Now we'll study after they tested the main primary organ as well as the tract. Now we'll study some important features of the accessory gland. The three accessory glands are the seminal vesicles, as we have already seen, with the prostate and small glands here. These are called as the bulbourethral gland. These are the also called as the Cooper's gland. These are the accessory glands. What are the functions of these accessory glands? One is the secretion of the seminal fluid. Very important is the secretion of the seminal fluid, which helps in the nourishment as well as the activation of the sperm. Okay, so it helps in the nourishment as well as activation of the sperms, as well as it also, because it is a fluid medium, so they start flowing. So it also acts as a protection for the sperms, protection of the sperms. So it helps in the this fluid helps in the nourishment as well as activation as well as the protection of the sperms. First, we will talk about the seminal vesicles, which are just beside the vas. This is the vas deferens. This is the cut section. Just beside that is the seminal vesicle. This is the cut section of the same. So these are paired elongated glands, site located posterior and inferior to the bladder. As you can see, this is the posterior surface of the bladder. Okay, which is also called as the base of the bladder. Okay, so it is posterior. Okay, so in the posterior surface, you can see the seminal vesicle just beside the vas deferens. Lies lateral to the vas deferens, just lateral to the vas deferens. The function is it secretes almost 60% of the seminal fluid. That's why it's called as seminal fluid, because 60% is from the seminal vesicles. So these are seminal vesicles which secrete 60% of the seminal fluid. So the name of the fluid depends on these vesicles called as the seminal fluid. Now coming to the next structure. So this will seminal vesicle will drain into the ejaculatory duct. Okay, formed by the union of the lower end of the vas deferens as well as the duct of the seminal vesicle joined together to form the ejaculatory duct. The cell length is very short, just 2.5 centimeters before it opens into the prostatic urethra. Ends the two ejaculatory ducts, because there are two seminal vesicles, so there are two ejaculatory ducts opened into the prostatic urethra. So this is the prostatic urethra, the urethra which passes through the prostate on the both the sides of the seminal folliculus. Okay, so they are opening from either side of the seminal folliculus. Later I will show you. Okay, so here you can see here opening of ejaculation. This is called as the follicular, and within that on either side you can see the ejaculation. Okay, the function, they drain the seminal fluid into the prostatic urethra. So So the main function is to drain the seminal fluid into the prostatic urethra along with the sperms. Now going to the next important gland, the largest gland, male accessory gland, male reproductive accessory gland. Okay, so that is the prostate. So this is the largest male accessory reproductive gland. So this is the prostate here. This is the different views. This is the front view. This is the side view. This is the cross section of the prostate. The different three views of the prostate. It is a fibromuscular gland tissue, as you can see here. It is a fibromuscular glandular tissue. It is walnut size. It is the size of a walnut. Okay, it is located at the neck of the bladder. As you see, this is the bladder, urine bladder, just at the neck of the bladder is below. As you know, the base of the bladder is behind and the neck of the bladder is below. So at the neck of the bladder is the prostate. So it is traversed by the prostatic urethra. So this prostate gland is traversed by the prostatic urethra. This is the prostatic urethra is passing through it. It secretes 20 to 30% of the seminal fluid, even though it is the largest male accessory reproductive gland, but it secretes only 20 to 30%. So, but the seminal fluid is mainly secreted by the seminal vesicles. Shape of the prostate, it is conical in shape. As you can see here, it looks like a ice cream cone. It has a base which is the superior. This is called as the base of the prostate, which is at the neck of the bladder, attached to the neck of the urine bladder. Then the apex, this is the inferior. This is called apex. Rest on the urogenital diaphragm. This is the urogenital diaphragm. Here you can see this is the urogenital diaphragm. The neck will rest on the urogenital diaphragm, and there are four surfaces: anterior, posterior, and two lateral surfaces. So this is the anterior surface, this is the side view. So this is the anterior surface, this is the posterior surface, and two lateral. This is the anterior view, so there are two lateral surfaces, right and left. Function, as you know, it secretes the enzymes which have the following function. One is it aids in activating the sperm motility. So the sperm motility is a very important thing which will be done by the secretions from the prostate gland. Then it also helps in the mucus degradation, removal of the mucus. If there is large quantity of mucus, then it leads to infertility. So the mucus is removed by the prostatic gland. Then the third is the neutralize the acidity of the female reproductive tract, which is alkaline. Okay. Okay, so it helps in the neutralizing the female reproductive tract. If this secretion is not there, without the prostatic secretion, then the sperms, as soon as they go into the alkaline medium, then they will be killed by the fluid secreted from the vagina. So this secretion from the prostate will help in the neutralization of the female reproductive tract, so that the sperms can be alive. Now coming to the capsules and relations, it is covered by a dense fibrous capsule, very important capsule called as the prostatic capsule, which is surrounded from outside by a fibrous prostatic sheath. The whole of the prostate is covered by a prostatic sheath. The latter is contains with the pure prostatic part of the levator muscle, the levator prostate. Okay, so that is the prostatic sheath is contains with the levator muscle. In between the prostatic capsule and the prostatic facial sheath lies the prostatic venous plexus, as you can see here in this picture. So this is the fibrous capsule, and outside is the fascia, the facial sheath of the prostate. In between is the venous capillary plexus. So whenever you want to remove, if you see here also you can see here is the fibrous capsule, and outside is the sheath, and in between you can see the plexus of veins, plexus of vein. This is very important because whenever you remove the prostate, you cannot remove the prostate alone, but along with this whole of the fibrous sheath, so that there is no bleeding because of this venous plexus. Okay, so it should be removed along with the facial sheath and all. Coming to the relations, anteriorly the pubic symphysis, as you see here, this is the side view. Anteriorly there is the pubic symphysis. Okay. Posteriorly we have the rectum. This is how you do the PR examination to feel the prostate, especially in case of males after 40 years. You always make sure that you feel the prostate and feel whether there is benign hypertrophy of the prostate. This can be done by putting with the finger through the rectum and feeling the prostate. This is how it is done. Okay, this is called as PR examination. Then inferiorly, we have the urogenital diaphragm. Inferiorly, this prostate has inferiorly it is related to urogenital diaphragm. Superiorly, it is related to the neck of the bladder, and laterally, the medial margin of the levator muscles. These are on the lateral side. Now coming to the lobes of the prostate, very important. The prostate is divided to 5 lobes. Very important again clinically because all lobes are not involved in carcinoma, the benign hypertrophy, but there are particular lobes which are involved. So you should know what are the lobes which are present around the prostate. So the prostate is divided into 5 lobes according to the relation to the urethra. In relation to the urethra, they are classified into the anterior, posterior, and other things. Anterior lobe, so which is in front of the urethra, that is the isthmus, lies anterior to the urethra. It is fibromuscular nature. Posterior lobe, posterior to the urethra, and inferior to the ejaculatory duct. So posterior to the urethra, the urethra, posterior, and inferior to this is the ejaculatory duct. So this is called as the posterior lobe. Then 2 lateral lobes on each side of the urethra. So in this view, you can see these are the 2 lateral lobes on either side. Okay. Then median lobe or the middle lobe between the urethra and the ejaculated duct. Between the urethra and the ejaculated, this is called as a median lobe. Okay. Between the urethra and the ejaculated duct and closely related to the urine bladder. Very closely related to the urine bladder. So whenever it is enlarged, then it compresses not only the urethra but also the bladder also. Usually it projects into the lumen of the bladder, destroying the internal urethral sphincter after the age of 40 years. Usually after the age of 40, here is the internal urethral sphincter. So this enlarges and it sometimes destroys the functioning of the internal urethral sphincter. The median and 2 lateral lobes are rich in glandular tissue. Median lobe as well as lateral lobe is glandular tissue and the anterior lobe is fibromuscular in nature. So depending on this structure, there are different diseases which are related to that particular lobe that you study in pathology. I will not go into details. Coming to the blood supply and lymphatic drainage, the blood supply is by the inferior vesicular artery from the internal iliac artery. So there will be, this is the internal iliac artery, the vesicular artery that is called as the intravesical artery. The prostate venous plexus, prostatic venous plexus, you see this is the prostate cut section, and you can see around that there is prostatic plexus of veins. Okay, lies between the prostatic fibrous capsule and the prostatic sheath, as you saw already. It drains into the internal iliac group of internal iliac vein. So if you see the internal iliac vein, it is draining into the internal iliac vein. It is continuous superiorly with the vesical venous plexus of the urine bladder and posterior to the internal vertebral venous plexus. So it is this prostatic plexus is not alone, but it is connected with the internal vertebral plexus as well as the plexus around the urine bladder. Okay, this relation again is important because if there is any case of carcinoma which can spread to the veins, then it can lead to this. Okay. Coming to the lymphatic drainage, it is draining into the internal iliac group of lymph inside. Okay. So now this is the picture showing you the prostatic urethra. Okay, so this is the prostate around, this is the glandular tissue, and inside, so this is the passage of the prostatic urethra. Prostatic urethra is important with some features you can see here. Structure seen on the posterior wall of the prostatic urethra. So the anterior wall is cut so that you can see the posterior wall where there are important structures. One is the urethral crust, a longitudinal elevated ridge. This is called as the urethral crust ridge. Okay. Then the prostatic sinus, a groove on each side of the crust. On each side of the crust, there is a groove. So here is the crust, urethral crust. On each side, there is a prostatic sinus. Sinus means space. Okay, on either side of the urethral crust, there are sinuses. A groove on each side of the crust. the prostate gland opens into the prostatic sinus. So if you see here, all these openings are the openings of the prostatic gland into this sinus. Then we have the prostatic utricle. So you can see here is the prostatic utricle, a depression on the summit of the urethral crust. The ejaculated ducts open on the sides of this utricle. So beside the utricle, you can see these are the openings of the ejaculated duct. Then the seminal collicus, a rounded eminence that opens into the prostatic utricle. So this is the seminal colliculus which opens into the prostatic utricle. So this is called this is the structure of the prostatic urethra. Now coming to the bulbourethral gland, very small glands here. This is the prostate, this is the prostatic the urethra, and just beside that is a small glands called as the Cooper's gland or the bulbourethral gland. These are small paired glands located on the base of the penis, secrete alkaline mucus for neutralization of the urinary acid as well as helping lubrication. So this is the function of this the bulbourethral, very small glands called as the Cooper's gland. Finally, coming to the penis, that is the male copulatory organ as well as the for the passage of urine. So it is a copulatory as well as the excretory organ. Okay, excretory by the penile urethra. Penile urethra is here. So this is called as sponge urethra, which transmit urine as well as the seminal fluid. So the function of the urethra is not one in case of male, but two. It not only helps in the passage of urine outside, but also the even the seminal fluid. Then it is said to be a copulatory organ, and this has three cylindrical masses of erectile tissue. So it has three masses, one, two, and three. So if you see here, these are the three masses. Okay. So this is called as the corpus cavernosum. Okay. Cavernosum singular, cavernosum means two. Okay. So there are two corpus cavernosum on either side. Cavernosum because there are spaces. Okay, venous spaces. That's what is called a cavernosum. Then one below this called as the corpus spongiosum. The cavernosum will be the actually the erectile tissue, and the corpus spongiosum is non-erectile. So it is spongy. That's why the urethra passes through this. So as you can see here, these are the two corpora cavernosa, which are the erectile tissue, two superior right and left masses of primary erectile tissue. So whenever there is accumulation of blood here, then it will lead to action of the penis. They provide the majority of the rigidity and length of the penis. So these corpora cavernosa will provide the actual rigidity as well as the length to the penis whenever the blood is stagnant there. Their posterior expansion forms the two crura. As you can see here, as it goes behind, it forms a crus. Okay. Together it is called the two on either side, but together it is called as the crurae. Okay. Okay. Also called as the anchoring tissue because it is attached to the bone. Again, the pelvic bone. So that's what is called as the anchoring tissue. These are called as crura. Okay. Crus on one side, crus on the other side. Together they call as the crurae. Coming to the corpus spongiosum is below here. Corpus spongiosum, as you saw, this is a non-erectile tissue. So the single inferior mass, secondary erectile tissue or non-erectile tissue to be more specific. It is traversed by the penile urethra. So this is the passage of the penile urethra. Its anterior expansion from the glans penis, as you can see, this corpus spongiosum anteriorly forms larger structure called as the glans penis. Its posterior expansion from the bulb of the penis. Posteriorly from the bulb, anterior from the glans. That is the same corpus spongiosum. And the skin is in front of that glands that form the prepuce or the foreskin, which is removed during circumcision. Fold of skin covering the glans penis before circumcision. During circumcision, that skin is removed from this glans penis. So this is all about this lecture about the male reproductive system. So if you have any doubts, any questions regarding this, you can ask me. Any questions? Okay. So,
Okay, شكرا. Thank you, doctor.
okay, thank you very much.